and I congratulate the Mushirabad unit and all the staff for being here and also making it possible to have one of the most advanced cardiac catheterization laboratories. Then the quality of the image, as we saw, was astounding, and it makes it safer for patients, and the outcomes are definitely going to improve. Then while we talk about technology, technology doesn't make an institution or a cardiologist or a team great. What makes a difference to the patients is not technology alone, because technology is there everywhere. You have money, you buy a technology. So the world of technology has become flat. But what makes a difference to the community or individual patient is a cardiologist who does a procedure only when needed, not when not needed, and does an angioplasty or a stenting only when needed, not when not needed. So there used to be a saying about surgeons earlier. A good surgeon does a good operation, but a great surgeon is the one who knows when not to operate and for the best outcome of the patient. It is applicable to cardiologists today because more and more cardiac interventions for which there was disease for bypass surgery or other procedures, now they are needing a cardiac intervention by way of a cardiac catheter, whether it is angioplasty, stenting or valvuloplasty, etc. So a good cardiologist will be the one who knows when not to unnecessarily do a procedure, because there is increasing awareness in public now. It is there in our newspapers daily now, how we are overusing and exploiting the public of this facility. Technology, when you buy an equipment and it is costly, the whole system becomes costlier. So there is what is called in a private hospitals, it is said unnecessary procedures are done because they have to make it cost effective. But mind you, it is not just private hospitals, the public hospitals also are doing the same. So first requirement in all this is acceptance of the fact that a lot of procedures are overdone and unnecessarily done, and also change it. How do we change it unless we discipline ourselves? Inside the institution, care now has a method by which we built in second opinion into the system rather than making it only when needed. Because by second opinion one means taking more than one opinion before you do a major procedure for a patient, like an angioplasty or bypass surgery. So as a rule, most of our patients, or almost all of them now, have more than one cardiologist seeing the patient, and only when more than one person agrees a procedure is done. That is there in the system now for us. So an inbuilt system of safety to the patient so that patients get what is best actually. So that's what we try to do, and the same principle will be followed in Mushirabad also. So then while doing this, there is so much of duplication of this technology now, because it is available everywhere, and peculiarly the Arogyasri, as it is called, requires that even a smaller hospitals require cardiac catheterization laboratories and including cardiac surgery. That's not a nice concept. So a lot of patients will not be getting the best in all this. Unless you have a team of people who can do the best, individual patients don't get the best and they can even be harmed. I am sure Mr. Prasad being in the government, she can make some thing possible so that they are not unnecessarily done. Duplication can be avoided. And many of us may not be aware here that Mr. Prasad is not just a policeman. He is a physicist. His interest in physics is known to everybody. He has done a lot of original work in the area of physics. He continues to do. That's what I came to know. Actually, these technologies we use in medicine, particularly the Cath lab, is based upon the principle of small particles in say inactive matter. Detection of smallest of particles makes medical imaging the best possible now. I think he will know more about it than many of us sitting here. So I welcome you here, sir. Thank you very much for being here. Thank you all for all this.